Good morning, everyone. Am I audible? Yeah. I hope I am audible. Can anybody respond? Yeah, right. Thank you. As you know all already, it has been the news has been percolated that RGUHS has undergone an MOU with respect to the further training of the postgraduate students and other things. Sir, please come. So in this regard, Zoom meeting is arranged, and Honorable Vice Chancellor is busy with other work. So I'm afraid that he may not be able to join today. But we have with us a delegation from UK, from GTEC, that is the Global Training and Education Center, which has got a training centers at 3 hospitals under NHS Trust. And I welcome you all for this meeting. We have with us our Dean of Medical Faculty, that is Dr. Dayanand sir, who is a professor and HOD from Bangalore Medical College. So he's also with us. And let me introduce Dr. Namrata. Dr. Namrata from GTEC, and Mr. Abhinav from Vidyashankar from Abhinav. He is coordinating between the RGHS and the GTEC Center, and Dr. Rachel, Mrs. Rachel from UK, and that is from Global Training and Education Center, and Dr. Raj Murli is from GTEC, and Dr. Shashidhar Madhapura, who is from our own state, and from nearby Bangalore. He is from Hassan district. So sir is a lead in that center. So he's also with us, and Dr. Nirmal Kumar. Dr. Nirmal Kumar, who is also from GTEC Center. So basically, the RGHS has signed an MOU which will help many of the postgraduate as well as sometimes the graduates to get trained under these institutes of GTEC at UK, and the student can go for an observership also. Those things will have to be explored by us. And another important agenda of the MOU is to establish MRCP or FRCP examination center in the state of Karnataka, especially in Bangalore. That is also one of the primary objectives. So I request Dr. Shashidhar Madhapur to brief about the center and the way forward. Thanks.
Thank you, sir. Let me share the presentation. ನಮಸ್ಕಾರ ಎಲ್ಲರಿಗೂ. ಪ್ರೆಸೆಂಟೇಷನ್ ಇಂಗ್ಲಿಷ್ ಅಲ್ಲಿ ಮಾಡ್ತಾನೆ. ಈಗ ನಿನ್ನೆ ನಮಗೆಲ್ಲ ಒಂದು ಚರಿತ್ರೆ ಮಾಡಿದ ದಿವಸ ಅಂದ್ರೆ ನಿನ್ನೆ ಒಂದು ಮೆಮೊರಾಂಡಮ್ ಅಂಡರ್ಸ್ಟ್ಯಾಂಡಿಂಗ್ ಅಂತ ಹೇಳಿ ರಾಜೀವ್ ಗಾಂಧಿ ವೈದ್ಯಕೀಯ ವಿಜ್ಞಾನದ ವಿಶ್ವವಿದ್ಯಾಲಯ ಮತ್ತೆ ಗ್ಲೋಬಲ್ ಟ್ರೈನಿಂಗ್ ಎಜುಕೇಶನ್ ಸೆಂಟರ್ ಜೊತೆ ಒಂದು ಒಪ್ಪಂದ ಮಾಡಿದ್ವಿ. ಅದ್ರ ಬಗ್ಗೆ ಒಂದು ಮಾಡಿದ್ಮೇಲೆ ನೆಕ್ಸ್ಟ್ ಏನ್ ಮಾಡ್ಬೇಕು ಅಂತ ಹೇಳಿ ಇವತ್ತಿನ ಒಂದು ಪ್ರೆಸೆಂಟೇಶನ್ ಏನ್ ಮಾಡ್ತೀನಿ ಅಂದ್ರೆ, ಮೊದಲು 10-15 ನಿಮಿಷ ಒಂದು ಪ್ರೆಸೆಂಟೇಶನ್ ಮಾಡ್ತೇನೆ ನಾನು. ಏನ್ ಮಾಡ್ಬೋದು, ಏನ್ ಮಾಡ್ಬೇಕು ಅಂತ ನಾವು ಅನ್ಕೊಂಡಿದೀವಿ ಅಂತ, ಅದು ನಮ್ ಕಡೆಯಿಂದ ಏನ್ ಮಾಡ್ಬೋದು, ಏನ್ ಮಾಡ್ಲಿಕ್ಕೆ ಆಗ್ತದೆ ಅಂತ. ಅದು ಸಾಕಾಗೋದಿಲ್ಲ, ಯಾಕಂದ್ರೆ ನಮಗೆ ಏನು ಬೇಕು, ಏನ್ ನಿಮಗೆ ಕೆಲಸ ಮಾಡ್ತದೆ ಅದು ಬೇಕು. ಮೊದಲು ಪ್ರೆಸೆಂಟೇಶನ್ ಮಾಡಿದ್ಮೇಲೆ 15 ನಿಮಿಷ ಆದ್ಮೇಲೆ ಇನ್ನೊಂದು ಅರ್ಧ ಗಂಟೆ ಅಥವಾ 3/4 ಗಂಟೆ ಸ್ವಲ್ಪ ಡಿಸ್ಕಷನ್ ಮಾಡಿದ್ರೆ ನಿಮ್ಮ ಎಕ್ಸ್ಪೆಕ್ಟೇಷನ್ಸ್ ಏನು, ಏನ್ ಮಾಡ್ಬೋದು ಹೇಳಿ ಗೊತ್ತಾದ್ರೆ ಆಮೇಲೆ ನಾವು ಮುಂದಕ್ಕೆ ಏನ್ ಮಾಡ್ಬೋದು ಅಂತ ಹೇಳಿ ಅದನ್ನ Professor Shirmukappa, Rajav Gandhi University registrar ಮತ್ತೆ rest of the team ಜೊತೆ ಪ್ಲಾನ್ ಮಾಡ್ತೀವಿ. ಪ್ರೆಸೆಂಟೇಷನ್ ಮಾಡ್ತೀನಿ. ಆಗ್ಲೇ ನಾವೆಲ್ಲ ಇಂಟ್ರೊಡ್ಯೂಸ್ ಮಾಡ್ಕೊಂಡಿದ್ವಿ. ನನ್ನ ಜೊತೆ Sir Rajmurli, Professor Nirmal Kumar, H. Leather is here. They're all part of the same. So ultimately, yesterday's collaboration was for one important purpose: advancing medical education globally with the Rajiv Gandhi University Health Sciences, and ultimately,
Just not audible, 2 or 3 messages have come.
ಇದು ಅಲ್ಲಿಗೆ ಬರ್ಬೇಕಾ?
You maybe swap where Raj is speaking.
ಇದು ಪ್ರೆಸ್ ಮಾಡ್ಬೇಕಾ?
Just talk again and ask them.
hello, can you all hear me? ಕೇಳ್ತಾ ಇದೆಯಾ?
Little louder.
ಕೇಳ್ತಾ ಇರೋದು ಮತ್ತೆ ಥ್ಯಾಂಕ್ ಯು. ಸೊ advancing medical education with patient safety, most important ನಮಗೆ ಇವೆ. So ಏನ್ ಮಾತಾಡ್ತೀನಿ first and foremost things, I'm going to give a little bit of information about what we are, what is Global Training Education Center, and what's our shared vision and objectives, and what is this collaboration about, which we talked about yesterday and which we signed. And then we'll have some strategic discussion with you. Obviously, your feedback is very important. We want to learn from you. We want to know what works for you. So, followed by, we'll then progress on to talk about what we can do further. So, Global Training Education Center is located in Writing and Vegan and Lee Teaching Hospital NHS Trust. We are part of the NHS Trust, but we are an international hub for medical education, clinical training, global works development, and ultimately we are committed to promoting patient safety and the global goal of WHO goal of saving lives. The way we do that is by various different programs which is listed there: structure fellowship programs, life support advanced training programs, and developing faculty members and the leadership roles, and having this partnership for global medical education. One of the things which we started 7 years ago, we extend it further with a new MOU. Our ethos are very simple: learn, earn, return, and excel. So we empower doctors, healthcare professionals in NHS standards of patient safety and quality care. That will in turn have an impact on extending development of clinical excellence and leadership capability. Not only it's very important to develop clinical skills, even more important for developing that leadership capability, that they will not only deliver clinical skills, but bring leadership so that they can shape the future doctors, future nurses, future healthcare professionals. So GTEC stands as a bridge between nations, shaping a future-ready global healthcare workforce dedicated for improving patient safety. The way we do that is by collaborating with several people. So we represent several organizations. The few I've listed, there are few more. The main things are Royal College of Surgeons of Edinburgh, Professor Nirmal Kumar, who is here, sits under College Council. Royal College of Surgeons of India, General Medical Council, and National Health Research, to say the few, but there are several. So these are various different organizations we collaborate and work with. The purpose of the MOU which we signed yesterday was to have a partnership which strengthen medical education and clinical training and build a future-ready global healthcare workforce. Because without that, we won't be able to proceed further in terms of meeting the ultimate goal. So objective collaboration, like I said, advance in medical education standards together for RGUHS. There are excellent things which happens here. There are also things which happen in UK. So we could work together, learn from each other, collaborate, and to grow together. And thereby, you can enable global leadership in both health skill delivery and patient care. And with a view to have appropriate faculty exchanges, which will ultimately result in service transformation. The key themes for the discussion today would be these. What I'll do is I'll give you some example of these things, and then we'll come back to the same slide and we can go through one by one, and where it will be very, very important for us to hear from you. The key themes of discussions are education, alignment, all these little things which I've put in, but I'm going to go through one by one. So when I talk about education alignment, what will work is a NHS fellowship standards, which meets the Rajiv Gandhi University Health Sciences training standards. A creation of pathways for people who come for training in UK, and when they come back, they should have a combination of excellent training and leadership, which can then foster the growth of curriculum and leadership pathways in India. And there are also opportunities for Greater Manchester, University of Greater Manchester in validation, and both offshore campuses, both in UK as well as India, for dual recognition of courses. The next bit, which is we would think about, is curriculum mapping and design, which meets both UK and Indian standards so that it can be duly recognized. So yesterday there were a lot of questions around simulation. That is something which we are very much involved with, both in undergraduate and postgraduate simulation training. And to make any program better, it always has to have a quite robust fundamental quality assurance program, which is critically appraising what the existing education structure is, quality inspection, followed by appropriate feedback and support to move it from point A to point B. I'm sure we all agree that if you want to enhance and develop medical education, we need expert faculty. So faculty exchange program with appropriate faculty training to be able to meet the global need of healthcare delivery is very, very important. So we could have an NHS, an RGUHS faculty recognition program, and build a global faculty network and leadership network. That brings up to what is known as a structured written leadership program. So I already said earlier about leaders are important in healthcare delivery. So we don't necessarily thinking about just improving clinical skills, improving the clinical skills and leadership quality within the individual, who can then handhold a junior doctor, future doctors, and then take them to their leadership journey so that they can deliver and mentor future healthcare models. So, for example, there are some programs which you already got. The MSc in Compassion Leadership is one example where we could think about, but there are several we could develop based on your input. So I said earlier that the ultimate aim of global medical education is to improve patient safety and save lives. So that's a global theme for WHO, global theme for any healthcare delivery, any country for that matter. So we need to learn about the safety culture, but the safety culture designed for NHS may not necessarily meet all the safety structure necessary for India. So that's where we can work together, where we can learn, design a safety structure which meet both UK standards, Indian standards, and that will help local healthcare delivery. An opportunity for mutual learning. One of the important things when we talk about healthcare delivery is there's a lot of wastage. We see a lot of wastage. Definitely across UK, we see a lot of that. I think we can learn from a lot of things which happens in India in terms of sustainable healthcare delivery. So we could develop joint hub for patient safety and also have life support and patient safety training hubs. A shared model. So shared patient delivery quality improvement model. So one of the other important thing is impact on return leaders and safety outcomes. So in terms of training, one of the important things which I actually want to mention here it's important that so when we talk about fellowship programs for the people coming to UK, we want them to go through all these things, not just as a clinical training, their leadership journey, taking part in quality improvement programs. So obviously we are coming back in November and we are actually interviewing for international fellowship program on the 9th of November in Bangalore. The information is already out. That will come to you again through the university. It's very important. The next bit is very, very important, very dear to us is because of our relation with the NIHR, identifying shared responsibility is very, very important. And one of the key areas where we do is there are a lot of things happen in India. One of the things which we recognize which doesn't happen is that what comes out does not get published. Without visibility, without data, we can't celebrate what we're doing, no matter how excellent things are done. So maybe there is a room for academic writing mentorship network to support fellows and fellows in producing high quality research. We are in the era of AI. I think AI will complement healthcare. That's where there's a need of some collaboration in terms of global digital learning and AI hub to promote AI and non-AI academic exchange. Real success is when all these things that I talked about leads into service change. Ultimately, if you don't change the service, that's not going to deliver what you want. So our vision is for any recognized institute under Rajiv Gandhi University of Health Sciences to become center of excellence in shaping through this partnership. And we can make sure that we have the visibility together with the RGUHS by having some impact case studies, which will influence local state health policies, national policy, and global models. For that, again, another example would be a MBA in global healthcare management. That is something which is very much suitable. So I'm going to stop at this point and then I will start putting items which we can discuss. The first one I'm thinking about is education alignment and curriculum excellence. Under that, what would work for you? What shall we take it with us to develop further? What can we work with the university? So, quite happy to take questions on this, hear from you really, more than the questions. We'll come back to the question at the end. Maybe some idea about what are you looking for in this kind of relationships. So I'm going to allow you to manage. If people are on lines raising the hand, I think perhaps I'm going to pass the screen share if people want to come. The first item is education alignment and curricular excellence. Thank you. I can go back and share. So let's talk about. I think we
There's
have
one raised hand.
one raised hand.
Dr. Baswaraj, please go on.
Dr. Basuraj.
They can unmute themselves.
ಬಸವರಾಜ್ ಅವರು ಮ್ಯೂಟ್ ಅಲ್ಲಿ ಇದ್ದೀರಾ? ಅನ್ಮ್ಯೂಟ್ ಮಾಡಿ.
Yeah, thank you. Thank you very much for an excellent presentation. And thanks to Rajiv Gandhi University Vice Chancellor, especially Dr. Bhagavan sir and Dr. Shenmukha sir, and all the team of Rajiv Gandhi University of Health Science. I was keenly going through the presentation. There are two things where Indira Gandhi Institute of Child Health, which comes under Rajiv Gandhi University of Health Sciences, especially which is related to the pediatrics, where ours is mainly a pediatric hospital. Since we are running many programs of a fellowship program of a pediatric subspecialty, that is where we can collaborate with the Manchester and so that we can bring an excellence in one fine-tuning the curriculum, two exchange of a fellowships students, especially those who are working in our institute and also to the other places. That's another thing where it is going to be useful, because pediatric is one of the thing where now subspecialties are being emerging, and in the Western countries where the lot of pediatric subspecialties which has been already emerged and which has been matured, that's where the really this collaboration in terms of an increasing the quality of a care of a children's in Karnataka, it is going to be useful. That's the one place where just I thought it will be a very, very useful, which is related to the alignment with the education is concerned and curriculum is concerned. And another important thing, even the existing faculties, if you have a faculty exchange program and all, that is the other place where it can be a very, very useful thing, because that brings the standard of a care. For example, in a critical care, now the lot of things which has been coming, ECMO and all, which has been well established in the Western countries, but here in India, this is the things which is now an emerging phenomena. This is where the other things which can be useful. These are just, I thought I'll put it in initially. If there are any other things, I'll come back to this. Thank you. Thank you very much.
Thank you, Dr. Baswaraj. Dr. Prasad sir, unmute ಮಾಡಿ.
Yeah, good afternoon, everybody. Thank you, Professor Madhapura Shashidhar sir and all the experienced faculty there for your insight into this exchange program between UK and RGUHS. Just again coming to, I'm a pediatrician. I worked for 11 years in UK. And when it comes to the assessment of students at the PG level or anything, there is a bit of uniformity in UK when we assess the in exams for students and for registrars. And already in India, even in Bangalore, we are already conducting overseas MRCPCH examinations. And I'm proud to say I'm also one of the MRCPCH examiner elected and appointed by Royal College of Pediatrics and Child Health. And it's already going on. And I feel the assessment process when it comes to in these MRCPC examinations is very objective and uniform without any bias or anything. So whether we can implement the same type of examination process in our medical colleges, especially when it comes to PG level, postgraduate level. At undergraduate level, it may be technically may not be possible because of the high number of students. But at postgraduate level, we can manage that. And in Bangalore and Karnataka, we are already nearly 6 or 7 MRCPS examiner. And Dr. Karthik Nagesh, who is attached to Manipal Hospital, is one of the lead examiners. So that's the one thing which, as Professor Madhapur said, things are already going on the move. And whether we can implement these at the RGUHS level, where RGUHS will be accountable for these examinations. But now at present, these exams are going on from directly from Royal College of Pediatrics and Child Health UK. And we do Diet 1, Diet 2, Diet 3 exams. For example, in the month end, I'm going to Calcutta for MRCPCS Diet 3 exams. So these things are going on. So that's one thing where I'm sorry to say I'm not criticizing our medical system. Assessment is also good. But when it comes to uniformity, unbiased, unstereotyped approach with equal opportunity, I think the UK exams are better. So this is one area where we can improve. That's the one.
Thank you.
Thank you.
Thank you. Can I just respond to
Yeah,
that?
please.
So, Dr. Prasad, thank you very much for that. And that is something which we are also looking at. So, for example, Professor Nirmal Kaur, who is here, he sits on the Royal College of Surgeons of Edinburgh Council. So, one of the aspects we are looking at is various membership exams. You talked about MRCPCH, whether there is a center in Karnataka. So, we are looking at what we can do to promote those things. One, in terms of the exams, in terms of curriculum development, quality assurance, and examination assessments. Yes, certainly we have group of people who sits on the examination committee, we sits and design exams and the structure for that. That is something we can work with the university, see what can we do to support. And it's also an opportunity for us to learn what works for Indian universities in terms of doing that. That's certainly something we can work on. I just also want to reflect back to Dr. Baswaraj, the Indian Institute of Child Health. I have the pleasure of having one of the pediatric anesthesia fellows in my own hospital who came through the program. She's done extremely well. She's been superbly trained. So we had the benefit of that. Obviously, that is something which is also happening. Yes, anything further to extend those partnerships and fellowship, it should be really, really useful. Thank you very much for that.
Sir, one more thing. Excuse me. Sorry, I'm Dr. Prasad. I'm working as a dean at the SS Institute of Medical Science and Research Center, Davangere. It's a central part of Karnataka. When it comes to the fellowship exchange program, is that the same thing where you are training like a foreign medical training exam fellowship or international medical training fellowship going on in UK? Do you mean it's the same thing?
So this, if you are referring to what is known as the MTI, we are not part of the MTI. We have a university fellowship scheme. So where there is a curriculum based on the university, they get a master's degree. And recently we started the DM. So where they go through a training. So during the period of training, they are attached to the university and to the NHS trust where they will work. Since you have worked in UK, they start working at the junior level and then progress to registrar level. And they typically start at ST2 level, which is the year 2 of training, and move up to ST3 or ST4 level in the second year, with the opportunity for an extension for a third year. And they get it. They
afternoon.
They get a chance to sit in the membership exams as well the UNIS exam, and they have the opportunity to excel in some specialty training of their choice, or some people who want to broaden their training within the big specialty. It varies between specialties. So that's what happens during that program. Thank you. Thank you. I have to start this right.
Yeah, thank you, sir. Just one more thing. You know,
Yeah.
we have many of our doctors have done post-graduation MD or MS in medical and allied and surgical subjects. And I consider it's as good as the same level of ST3 level of UK. Passing an MD exam is not easy. They have to do hard work for 3 years with dissertation and all. Why not they straight away go for extended ST3 level, and then you give them an opportunity to take exam, and then they go for ST400. Now, I'm giving my example of my son who has done MD in emergency medicine in India, and he cleared all the UK requirements, and now he straight away went at ST3, ST4 levels. So is that possible for our youngsters? Because again, going there and joining at ST1, 2 level, and again going up the ladder, I don't know, but you can give them the opportunity of going straight to ST3, ST4 level. Is that possible?
So the answer to the question, we have done an extensive review of the process of how these things happen. Students vary. There are some who excel. There's some who don't necessarily. It's not because of they haven't got the good training. It's the clinical training which is in part. It is the cultural differences, the different healthcare system, how things work, how things interact with each other. That needs a little bit of time to bed in. For example, I give examples of anesthesia, where I'm an anesthetist by background. The anesthesia training is uniform globally. Many of the doctors who come from anesthesia, they start at ST3, ST4 level. In other specialty, it can vary, but it depends on the first 3 months of their initial assessment of competency. If during the initial assessment of competency, and if they show that they are working at the level similar to ST3, that hospitals are more than happy to take them up to that level. It is where they start first, and to be given the chance to adapt, very, very important. Last thing we want is somebody to come and to have lack of support, assuming they can work at that level and the expectations are not met, and having a negative impact on their training, especially having spent so much effort to apply for the program, come to UK. So there is already flexibility in terms of what is known as a appraisal assessment or initial educational supervision meeting, where the level at which they need to work will be decided. So it's already there within our system.
Thank you, sir. And in our present curriculum, it's almost we are going towards the NHS or the British type of medical system. We are almost stepping into that. And that's also has come through NMC also. And when it comes to your curriculum, it's a must for our students ATCOM module. That's attitude, ethics, and communication skills. It's going on from the undergraduate level and also at PG level. So that's the one thing is there in the curriculum. And most of now the teaching and assessment is become most objective way of approach. And one more thing, sir, I would like to tell you is when it comes to these exams, these for UK exams, for example, when we started MRCPCH exams, we have to take the confidence of the Indian Academy of Pediatrics. So anything which you try to put in our country, for example, surgery, there is Indian Surgical Association, Indian Medical Association. I think the RGUHS may have an obligation to take their confidence also. If I'm wrong here, Shanmukappa sir, please pardon me, but that's what, even when we apply for examinership for MRCPCH, we have to go through the we have to get the confidence of IIP and then the Royal College. That's the system now. So that's the one area you may have to look into that. Thank you.
Thank you, sir. Thank you.
Shashidhar sir, just in continuation with Dr. Prasad sir, in fact, our Indian Academy of Pediatric, Manchester University, and also Oxford University Hospital, we are having an MOU and we'll be sending almost 6 to 10 postgraduates, means those who are for fellowship to the UK through the Indian Academy of Pediatric. Similar to that, you can establish something in association with Rajiv Gandhi University of Health Science, and also make an Indira Gandhi Institute as one of the Center for Excellence, something like that. You can work it out. That really is going to bring in a lot of technological transfer that will enhance the academic excellence in the subspecialties which are been emerging in India. Just it is just a submission, sir. Thank you.
Thank you, sir. Thank you. Absolutely, because there is the volume of the number of patients in India is huge. That's a breadth of experience that's going to bring, even for the UK graduates to come here, even for their observership part of the placement, we will definitely explore that. Thank you. Anything else? Education and curriculum excellence. Anything else? Anybody else? Anything in the chat? We'll go on to the next.
Sir, again, can I come back again? Because you said to patient safety and quality improvement and quality care to the patient. We now of late we are considering nurses also as our colleagues, as the system in UK. And is there any program to improve the nursing care, nursing care, and in turn patient safety and quality improvement, quality care, please?
So in terms of specific for the nursing, there have been a little bit of a decreased opportunity for international nurses because of the demand for the nurses have come down recently. However, in terms of patient care and delivery, I'm sure we all know that patient care is a team effort. And a doctor cannot deliver that. So whatever the training we provide in terms of leadership and teamwork or team resource management, it's all working together with the team of nurses, physiotherapists, other healthcare workers. So for example, if it is talking about MBTs, clinicians, surgeons, pathologists, radiologists, community healthcare workers, occupational therapists working together. So that is something which is already happening. We will take back and see what we could develop and what could we suggest to the Rajiv Gandhi Institute of Health Sciences in terms of what can we do. I think I would probably say the similar thing about one of the questions on pathology. Can I just, yeah.
Sir, very good afternoon, sir. I am Dr. Rajiv Kumar from Kanachur College of Pharmacy, Mangalore.
Yeah, please go
Yes,
ahead.
Just I wanted to know, there is one program, we call it as international level, transnational program. When the students are having a program 2 years over UK and 2 years like in India, is there that such a program to be developed in the pharmacy programs?
So we are looking at medical sciences. So obviously pharmacy is one of that. Again, some of those things we are going to discuss with your registrar and think about what could be developed in terms of whether that is something which can be developed mutually, with part of the program being in India, part of the program in UK.
Yes, sir. Already it is many of the country they are following transnational program, like they are having such a collaboration studies from students are exchanging the 2 years studies here and 2 years over there, like that it is already.
Yeah, thank you, sir. We'll come back to, we'll look at it, and there are some things on the chart. Can I just go? There is one. Scroll down.
Thank you. Thanks.
Scroll down. Yeah.
Thank you.
What best can be adopted in pathology subject between NHS and RGUHS? The fellowship certificate course histopathology, hematopathology, though online may not be difficult if it starts. Something we can take on, Raj? So,
Ticket to online course.
so with our university, University of Greater Manchester, we could explore a fellowship program, which could be both hybrid, online, or with some opportunity for observationship in UK and here. That's something we could take and we could develop. Yes, sir. What benefits are available for nurses? I think I've already talked about. So when we talk about histopathology, obviously the subspecialty in pathology would then be considered in terms of what resource elements, what equipment, diagnosis tools, what further training will have to be done. So we need to go towards looking at what's the local requirements, what the expectations are, how we can design the curriculum which meets both the UK and in India. Yeah, I'm just going to go to the next one so that we can look at other things. I'm going back to my sharing. I think I've already talked about faculty training and talent exchange. I'm just going to go to the research next, really, because there's something going on research. So want a little bit more information about what exactly you're looking at. Dr. Madhav Tigavi, could you please elaborate a little bit about the questions you're looking for there? Or anybody else for that matter? So these are the different
Hello, sir.
areas. Yeah, please, sir. Thank you.
Sir, good afternoon to all the members. What I feel is this is a very good initiative where we can make use of science and technology, and in the research perspective, our postgraduate research scholars or PhD research scholars can really be very well connected with this, either in hybrid mode or anything. It is one of the good area of opening where we can make use of internationally standard research programs, and we can meet the international level documentation or such programs for our postgraduates. It is really welcoming movement, sir.
Thank you, sir. So one of the things which part of this fellowship program is there is a clinical element of the training. There is also academic part. Academic part is heavily on research methodology. Critical appraisal of the literature. How do you conduct a good research? What classifies as a good research? What the research methodology is. So that's already there, which can be further extended in terms of what we can look at. So it's also important to think about what research would be relevant for Indian health practice. Especially, yesterday there was a question about how will we link up with modern medicine with other areas of medicine like Ayurveda and homeopathy. So one of the great thing about that is there is some evidence in terms of how these things work. So what is lacking to get a firm footing is good quality research in that. Obviously, that is something which will help in terms of getting those things better. So we need a little bit more information about what exactly you're looking for. If you're looking for research methodology in terms of doing a good quality research, what is a good quality research, how would you go about doing those things? Certainly, there are already workshops, there are courses which will give that skills. Anything else about research?
Uh,
Yes, sir.
Our Honorable Prime Minister, Sri Modi ji, now is putting a lot of money to research, and he is asking her to do something more innovative, inventative at low cost, indigenous low cost, so that we need not export anything, import anything from foreign countries. So do at the college level some innovative things, low cost, and which helps our population, especially in resource constrained area. So that is the theme now, Make in India Atmanirbhar. So I request RGUHS, if you can help through the NHS UK to align with this type of approach. If that's possible, it will be very helpful for us. And that's why we have been asked by NHS and from the Department of Family Health and Welfare, Government of India, to do research with this concept. And now I'm again proud to say, for RGUHS, our institute is one of the first institute to get the patency on study on bacteriophages, like prevention of bacterial biofilm hacking on the endotracheal tube lining by using bacteriophage, and that we have got patency, and that's the first patency to RGUHS also. So those type of studies where we are doing now, but now we have been asked to do this type of approach, low cost, innovative, make in India, Atmanirbhar.
Thank you,
Sir.
sir. Thank you, sir. So obviously, that's something which we can certainly extend our support in terms of what needs to happen. So we need some. If I may go back to the slide, I just want to
explore, sorry to interrupt, sir. Any update on allied health professions? Just, what is the scenario of allied science professions in UK and what are the opportunities for the graduates? If you can brief about that, it will be helpful.
So when we signed the first memorandum of understanding with Rajiv Gandhi University, I think NHS were very much into having supporting nurses, and we have the record of supporting more than 5,000 nurses and 1,000 doctors during the time. And nurses came, and we actually had hub of providing English language lessons and subsequent support for CBT and ASCII examinations. And they were also housed, free accommodation was provided with subsistence for them to succeed, and several of them are employed in the NHS. That obviously NHS vision has changed in terms of how this is going to develop further. So what at this point I don't have a direct answer in terms of talking about what can we do in these areas. Certainly, what we can do at the university level is to look at collaborative work towards providing better educational fellowship opportunities, which is hybrid with some placements back in UK as observationships and here, so that we can work together for that. That is something we can take back and explore that. Whether there will be opportunity for further employment for people to come to UK and establish is something we need to establish the national level with the NHS. Because our hat is more of educational support more than creating employment. So that's why I'm saying that, rather than committing to something that which I can't deliver. Rather be very honest and straightforward. But we can certainly explore what can be done and then bring it back to the university to discuss it further.
Sir, I have, sir, what is the role of the clinical pharmacist or hospital pharmacist in India, sir, in UK? Probably in Indian scenario, the role of clinical pharmacist or hospital is something different. I would seek about the role of pharmacist in NHS at the UK level is something different.
Pharmacists are part, they are part of the patient's care delivery on a daily basis. So, and they make a very important contribution. So every ward, if I can say, every ward, there will be a nominated pharmacist who will come, will look at the prescriptions, advise the doctors, look at the patient's conditions. So obviously, if somebody becomes acutely unwell, their condition change, and the patient who has had a normal renal function can deteriorate because of medical conditions, surgical conditions, medication has to be adjusted, dosage of antibiotics need to be reduced, dosage of immunocompromised medication have to be reduced, some medication may have to be stopped and we replace other things. All those things play a crucial part, and I, as a doctor, we look forward to pharmacists to advise me on those things rather than me finding an answer. They are the people who will do that. So they play a very important role in any of this.
I think in our curriculum, which is lacking, sir, in Indian scenario.
I think it's
we
going
need
to come.
revamp or restructure the syllabus or curriculum with regard to our Indian pharmacy syllabus.
My own niece is a pharmacist at NHS, and I sometimes ring her for advice. Can you imagine? So it is that kind of scenario there.
How is the scope for nurse practitioner in NHS?
Nurse practitioner is just coming up recently. There are a lot of nurse practitioners happening here. Yeah.
So
There's something else.
I just want to talk about this dentistry. Sir. How is the education levels in the dentistry?
We are not. So dentistry is a separate specialty of practice. The medical and dental it is. So it's a dental education comes in a different stream. So obviously we won't necessarily be able to link the dentist directly. So the honest answer would be, I don't know.
Many dentists are dually qualified. They are doctors and dentists. So especially they tend to do lots of maxillofacial work. The dentist, as we know it here, is also there, and they have their own practices. But people working in the hospital are dually qualified. Very intensive program to study both degrees. I don't think that's there in our country.
No, in our country, we don't have that.
So there are almost two lines, isn't it? That's the difference.
Is somebody online? You're on mute, sir.
Mute.
Salimullah sir, you are on mute. Please unmute.
Yeah, good afternoon. This is Dr. Salimullah Khan from PA College of Pharmacy. So in continuation to Dr. Ashok sir's question, now drug resistance is becoming a big problem, sir. So is there any possibility of research with complementary and alternative medicine, especially the Indian systems of medicine and the modern medicine, for the development of a good agent, discovery of an agent for drug resistance? Drug resistance, as you know, it's becoming a big issue all over the world. So this is an area which requires immediate attention, I guess.
Absolutely, sir. It is such an important topic because we have what is known as the antibiotic stewardship, a very important program in the NHS in terms of taking care in terms of prescribing antibiotics, when to prescribe antibiotics, and to make a decision, do we need to continue the antibiotics and what antibiotics, and not to overuse antibiotics. It's a nationwide program. There's an antibiotic stewardship program with champions in each NHS trust, NHS hospital. There are also antibiotic stewardship which extend to the community. In terms of research around alternative things is something we are not explored. Again, something we can take and see what we can come up with.
I think that's a very good area if you give a thought on that, actually, including Indian system of medicine into it.
Thank you, sir. We'll definitely take it back and see what we can do. I just want to ask a couple of more things in terms of faculty training and talent exchange. Is there anything which we can hear about that? And also leadership. Anyone on this?
Yes, can I enter, sir?
Professor Prasad, please come in.
Yeah. Sorry, sir, I'm again and again coming. I hope, is it okay again? I talk few words.
Yes, please. Thank you. Thank you.
Sir, when it comes to when it comes to faculty training and exchange program, I'd like to bring to your kind notice and your team that already the exchange program is going on at different levels between UK and India and with Karnataka at individual level, institutional level, and organization level. There's no one uniform proper channel in this area. For example, our institute in Davangere, we have exchange program in pediatric pulmonology with Birmingham Children's Hospital through one of the hospital organization in Pune and through IAP. And again, through Indian Academy of Pediatrics, we have exchange program in pediatric pulmonology. That's one of the example. And so if you are also planning some faculty program and exchange program through NHS and RGUHS, then there will be a lot of parallel things will be going on. So if it's a one way, my asking is whether you make a one proper channel so that everybody gets an equal opportunity here. So because sometimes when it comes to Birmingham, we do our own interview between our staff and the Birmingham staff, and we select a good candidate and we put them into the exchange program. So that's how it's happening now. So that's the one area. And the other thing is when it comes to leaderships, you said, sir, one of the things which really helped me in my career is in UK to get CCT. So good morning, Bhagavan, sir.
Good morning.
Dr. Prasad from Davangere.
Yeah.
I'm just speaking on leadership quality to Professor Madhapur, sir. Sir, the one thing which it helped me in my career is in UK to get CCT, they do DNRE management course, which is a 7-day course across 7 weeks, something like that. And that's a very good thing if we, through RGHS, if you can implement that into our PG curriculum, it will be fantastic. I'll tell you, it will help them a lot. Where there are aspects of leadership, stress management, ethics, auditing, research, everything in the DNRE management course. And if RGHS can make that compulsory for our postgraduates, like what they do in UK to get CCT, that will be fantastic. It's just a request, sir. Thank you very much.
So thank you. Thank you, sir. So the first thing is we talked about faculty training. We are more in terms of looking at the faculty from India and back in UK in terms of having the training in terms of something like a teach the trainer program in terms of delivering the skill-based training, for example, able to run good quality simulation training in enhance both undergraduate and postgraduate, which we are talking about. So I also want to congratulate you on those programs. You're already working with Birmingham. I think that should continue.
Thank you, sir.
It's also in terms of what can we do further in terms of improving your own faculty, or some of us coming and learning from things which you are doing. That's also it's a mutual. The medical education is evolved considerably both in India and across the globe. There are things which because I left India about 28 years ago. There are a lot of things I might learn from here similarly. So it's that kind of knowledge exchange which you're looking for. In terms of leadership program, there are various levels of leadership program which we can do. So for example, the 6-day leadership program, which ends up with a leadership project, is one of the things which is a simple one to do. But it's also can be a 6 months leadership program within university to the masters in leadership. So that depends on the extent to which we want to collaborate, or something we can work between the two countries where those leadership programs can be delivered here partly, and we lead on to some kind of major leadership project which will help deliver better service. That we can certainly work on. Thank you.
Thank you. Thank you. Thank you very much, sir.
ನೀವೇ ಮುಗಿಸ್ಬಿಟ್ರಲ್ಲ ಸರ್.
ಯಾರು ಮಾತಾಡ
Thank you, Prasad sir. Thank you very much. I think Shashi sir, anything else is there?
No, I just want to conclude. So obviously we touched upon a little bit about patient safety and quality governance earlier. So if there anything, I just want to, obviously all these things which I said will lead on to service, have an impact on service and global transformation. Just the key information we need from you is, we had some discussions. There are some ideas, good ideas. There are some excellent examples of things which are already happening. What we don't want is to stop those things happening. In fact, those things should continue. They complement. In terms of what we can do under this MOU, in terms of developing it further, maybe if there's any particular ideas from a particular institute, we need that. What are your specific requirements? A contact. Not today, obviously through the university channels. It will be important because then we can look at having some pilot centers where we can start doing this and to see what the outcome of that, whether it will be beneficial to both the UK and USS, and most importantly, USS. So I think we just had an agreement yesterday, and we're just wanting to put some early ideas into some kind of agreement into action. So that's hopefully we have started today. And obviously, if you do that and if you succeed, we need to create that visible impact which has a bigger foundation for future medical education and patient safety. And that meets what we all have signed for: global workforce with compassion. And that journey, I believe, has started with the signing of MOU yesterday, and we begin that shared journey from today. So I would need input from all of you. I know it's a staggering number of people who joined this conversation, and we have only spent an hour on this, but there's a lot more things to discuss, a lot more things where we can agree on, a lot more things we will disagree on some, but there will be some things which are very common where we can work together and make things better for both of us. And we can learn a lot more as well. This is a great opportunity for us as well. Thank you, sir. Thank you very much for that.
Thank you. Thank you very much, sir. taking this way forward. I think Dr. Shanmugappa, who is leading this initiative from the university's behalf, as one of the key proposals from the Honorable Vice Chancellor, following his study tour to UK. So the first step, what we have done is we have tried to sign up an agreement upon all the points which Shashidhar has shared with you in terms of fostering academic excellence, research, partnerships, assessments, and many more things to improvise the potential of the healthcare fraternity across both the countries. So thank you for joining at very short notice. I thank all the members of the GTech team who are here, who have taken the time one extra day, and they requested to speak to all the colleges. And I thank all the members who have joined today in spite of their busy schedules on such a short notice of the university. So the next steps, as sir has rightly pointed out, we have discussed what are the key areas which there would be some sort of collaboration. The next step would be, as sir has told, from agreement to action. And one of the slides which you saw was keen interest of the institutions to take this thing forward, both nursing, allied health science, physiotherapy, and the medical colleges. So any faculties, as Dr. Prasad from SSIMS and Dr. Baswaraj from Indira Gandhi and many other speakers who have spoken, and our BOS Pharmacy, Salimullah sir, we would request you to kindly put across your interest with the name of the institution, your contact number, your details, what are the things which is there in your mind, and send it across to the curriculum development cell, Dr. Shanmugappa in the university. And we shall compile these things in perspective and bucket them into what are the points through which it can go across. And then we will come back to you, and depending upon the discussions, further discussions by the Honorable Vice Chancellor and other members, what are the key points we can take this forward point by point. That would be the next agenda on the behalf. So all the institutions who have joined here or those who could not join today, please pass on the message to them. So let them give few basic details of institutions. I welcome our syndicate member, Professor Ramnath from Hassan. He has come for some other meeting and sir has been there. He's an anesthetist. So as I was telling, you can just share across your interest and your question or query, whatever is there, so that we can compile those things, discuss with the team, and then get back to you for further actions. So anything you would like to add, sir?
No, thank you.
Okay. So again, thanking all our deans, the curriculum development cell, the team from GTech, the syndicate member, all the participants and the heads of the institutes. Thank you very much for joining in, and we hope this meeting has brought about some key features which you can look at those things and express your interest and take this agreement forward into action. Thank you. Thank you very much.
Thank you very much, Riyaj Basha sir. Thank you.
Thank you, sir.